Welcome, learners. Many of the aspirants are so doubtful about what to study, to which portion of the subject has to be concentrated more, and etc. So, this is for them. Here, we are going to see some most important points or syllabus from anatomy that should not be left without study or revise before going to any examination, especially competitive examinations like APGET, NEET, JIPMA, State PSC or MRB, UPSC Medical Officer or Research Officer, any competitive exams, even for BHMS practical examination, Viva.
Let's begin with the disclaimer. The contents of the video are made only with the assumption through all previous question papers. So this doesn't claim that the questions will only be asked from these portions, but majority of the questions were asked in previous question paper from these syllabuses. Let's get started. First, muscles. Though all the muscles are very important, hand muscles are frequently asked. They are frequently asking questions from the hand muscles about their action, about their nerve supply, and etc. Next, named muscles. Few muscles are having other names. For example, sartorius is known as Taylor's muscle. Serratus anterior is also known as Boxer's muscle. So these types of questions can be asked. Not only for the muscles, even for the nerves, also for the bones. Other names are very, very important. Next, coming to the group of muscles, you will get the question like this. Following muscles are the rotator cuff muscles, except, like this you may get a question, or which is the nerve supply of the rotator cuff muscles, like this you will get the question. For example, rotator cuff muscles are subscapularis, supraspinatus, infraspinatus and teres minor. Within these four, they will delete any one of these muscle, and instead of that they will insert some other muscle. So exception will be there. So usually they will ask exception or nerve supply for the group of muscles, or the action. If there is any particular combined action for this group of muscle, they will ask that question, or peculiar insertion or origin for the group of muscle. That is also very, very important. As I told you, exceptions are very, very important, especially action exception, nerve supply exception. They are very, very important. For example, coming to the nerve supply, all the muscles of tongue are supplied by hypoglossal nerve except palatoglossus. Similarly, the muscles of palate, muscles of ear, muscles of larynx, all are having such type of exceptions. So we have to concentrate on that portion also. Next comes hybrid muscles. They are also known as composite muscles. What is a special feature about this hybrid muscles? Actually, they are having dual nerve supply. So they will ask about the nerve supply or about the names. All of the following are coming under hybrid muscle exception. Like this they may ask the question, or about nerve supply they may ask the question. Coming to the bones, most frequently fractured bone, which is the most frequently dislocated bone, which bone appears first, which bone appears last, what is the most common site of fracture in particular bone, which is the most common site of fracture in clavicle, which is the largest joint, which is the smallest joint. These types of questions will be asked frequently. For example, most common fracture seen during birth, that is clavicle. The long bone which does not possess medullary cavity, again that is clavicle. As I already told you, other names for the bones are again important, which is known as collarbone, that is clavicle. And in each and every bone, what is the clinical significance? You have to concentrate on that area also. And coming to the fracture and dislocation, you have to concentrate on the word, whether they are asking in general or about tarsal bone or about carpal bone or about horizontal bone or vertical bone. So be careful before choosing the answer. Coming to the nerves, nerve roots are very very important. What is the nerve root of median nerve? What is the nerve root of ulnar nerve? What is the nerve root value of sciatic nerve? These types of questions are frequently asked. Other than that, as I already told you, nerve supply to the hand muscles, they are frequently asked, especially ulnar nerve, radial nerve and median nerve. Again and again they are asking these type of questions. So be thorough about the nerve supply of these hand muscles. Next comes the nerve supply of particular compartment. For example, you may get a question like this: what is the nerve supply for the posterior compartment of leg? Tibial nerve. What is the nerve supply for the posterior compartment of thigh? Here the answer is sciatic nerve. What is the nerve supply of anterior compartment of arm? That is musculocutaneous nerve. So kindly know the answers for this each and every compartment nerve supplies, also the general actions for each and every compartment. And again, coming to the nerve injury, if a particular bone fracture occurs or dislocation occurs, which nerve will be get injured? For example, in case of lunate dislocation, which nerve will be affected? Answer is median nerve. So you have to answer to that such type of questions also. And coming to other thing, brachial plexus and cranial nerves are very very important. Anyway, you will get answers questions from brachial plexus. Sometimes you may get questions from divisions of brachial plexus or branches, cords or root values from the brachial plexus. For example, ulnar nerve is from medial cord, radial nerve is from posterior cord. So this type of questions will be asked. In case of cranial nerve, longest nerve, largest nerve, which is having the largest intracranial course, which is having the longest intracranial course, which is having the extracranial course. These type of questions will be asked. And again, coming to the cranial nerve, the nuclei are very very important. And vessels, again you will get questions like this: large arteries, especially the branches of large arteries will be frequently asked, and which is the smallest branch of this artery, which is the largest branch of this artery, which is the only medial branch of this artery, which is the only longest branch of this artery. This type of questions will be asked. And you should cover celiac trunk, aorta, external carotid artery, costocervical trunk, and you should complete circle of Wiley also. There are many more important things are there in anatomy, like clinical anatomy, what is the epithelium type in each and every organ. And again, heart is very very important, heart blood supply is very very important. Along with these above discussed portions, you may study whatever you want, but it should not get missed. Thank you.